I'm Janet Vega. I'm the Manager of Population Health Analytics for Baptist Health, South Florida. So at Baptist, we have a CIN and an ACO. We have like 10 payers, 10 contracts, including MSSP. The CIN is 10 years old, so this is what we have been working on and building for the last 10 years. Some of the many challenges, of course, surrounding data, getting data aligned, really understanding what the data is telling us and really being able to hone in on what we can impact, separating what we can impact versus what we can't impact. Patient engagement and really getting them in to see their providers in a timely manner. Patient engagement is a big thing. So one of the challenges is the engagement with our independent providers, right? Because they're on desperate EMRs, over 40 of them. And so not having access to their EMR is a challenge. And so being able to engage with them on patient information, before it was just handing out reports, Excel spreadsheets, and now we have rolled out EndNote with all the independent providers. And so now they're able to see, the risk scores. They're able to see, coding gaps, and pretty soon we're going to be rolling out quality as well. So that engagement is going very well. They love seeing things that they missed, like, oh wow, this patient is, I missed that coding gap last year. So that's going very well. So for 2024 is really focused on the ACO, maybe a little bit more than the other plans, on really practice transformation, really risk stratifying the patients to bring them in a cadence that will really support where they are in risk, to be able to code them properly, manage them properly, and of course rolling out in-care, which is something that we have not done yet. So we are teeing that up to be able to roll out in-care for our clinical team. The rollout from last year, which was really impressive. So that was a high bar, to go over, and you guys did. You delivered. So AI is something that I'm very interested in, a lot of research and hands-on, work with. And where Innovaccer was last year is where AI kind of was last year, what they're producing, and now the kind of advancements that they're making in AI is where AI is right now. So they're really on the cutting edge between where AI is at right now and their ability to implement that into into this environment, which is really impressive. At the thought leadership, and being able to execute on it. One thought leader in AI made a statement of AI is not going to replace humans, but humans that use AI will replace humans that don't. So, I thought long and hard on that, and it's very true, whether we like it or not. Even for what you do is focus on the productivity. Like they've been talking about, is the provider burnout or the care or the nurse burnout. I'm a black belt, part of my black background. So process improvement and efficiency is like my core, one of my core values. So seeing the increase in productivity and the ability to do more with less time, with less effort, is something that's very, very, I think, important. It's where we're going. So I've told my team, I've introduced a lot of things to them. We're working on some things internally that we can do. And so that we can set up my team for success and for the future, right? That we will be on the cutting edge, maybe more than other teams. I'm excited about all of them. Sarah is wonderful, and I'm sure Sarah will, morph over time and become even more powerful. Innovaccer's thought leadership in this area is very impressive, and some of the implementation of building agents, the call center agents, nurse agents. It's been proven that with a doctor, quote unquote, AI, that they were 10 times more empathetic than human. So there's great potential, and the place that Innovaccer is building, and the direction they're going, the thought leadership again, is very impressive and very exciting.